Great. Well, good to be here with you all this morning, and pretty exciting time for us at Sixth Sense because we've been working on this product here that I'm going to show you today for the last several years. Actually, the company Sixth Sense has been pioneering immersive technology for the last decade, and together with Penumbra, which some of you may be familiar with, medical device company, have created the real immersive system, which we're going to talk about and show you a little bit about today. But quickly, I'll introduce myself. I am Joel Breton. I'm president of Sixth Sense Studios, and my background has been creating digital content, digital applications, and games for the last 20 years. And so I've produced, created, designed, and developed over 200 video games in my career. And so I really know how to create digital content and applications quite well at this point. And about 4 years ago, HTC came and recruited me out of the game industry to come and help them create digital content, applications, and games across about 15 different industries. And you can see some of the content that we actually were able to create over the last several years at Vive. Everything from musical applications to 3D design applications like Make VR Pro, and educational design, and of course games like Ready Player One, which was actually one of the more fun products we got to make. It's a pretty interesting game if you ever get a chance. So all of these pieces of content are out live on either Viveport or Steam. So these are some of the products that we made. And one of the products that came across our attention while we were there was this product called the Real System. And when I first saw this, I was just blown away because I immediately realized what we were talking about. And back in January of 2018, there's sort of a meeting of the minds here between two very visionary CEOs, one being Amir Rubin, who's the founder of Sixth Sense, and the other being Adam, the CEO of Penumbra. And both of these gentlemen are visionaries in their own fields. And I think what happened was just this sort of perfect meeting of the minds here, where they were both looking for the future of their businesses and their industries, right? But coming at it from different perspectives. And what happened is they came together and created this product, which I'm going to show you a video of right here. Oh, there we go.
While virtual reality has been around for a long time, its application in rehabilitation of stroke and other neurological disorders is cutting edge and new concept. Here at Cooper University Healthcare, we are delighted that we have been chosen by Penumbra, the maker of this technology, to be the first center in the world to use this technology and to offer it to our patients to aid and augment their chances for recovery after stroke. The brain has great capacity to rewire, to form new connections. Our experts aid patients in executing these movements, and so the connections that are required for forming that movement are being rebuilt. So by stimulating certain areas of the brain, it helps the brain repair itself. There's no question that on the compliance side, I see great improvements just because this becomes a game that patients find joyful, and that leads to improved range of motions and all sorts of other factors that we know enhance recovery. As an academic medical center, Cooper University Healthcare is constantly adding new tools and therapies that aim to improve outcomes in the patients we treat. We are the first hospital in the world to use this technology. The real immersive system is, in my opinion, a potential huge breakthrough in recovery after stroke, and is yet another technology that we can offer our stroke patients in a patient-centered manner.
Yeah, so to me, that is just so inspiring. I mean, how many people here know someone or has somebody close to them that's had a stroke or experienced a stroke, right? My uncle has had 3, and it's just devastating, right, to have this happen in your life. And so anything that we can do as, creators or technology industry people that can help address this problem and help people recover after they've had such a catastrophic event in their life, to me, is something worth doing. So how do you go about creating a fully integrated system like this that will go about helping people have better outcomes in their therapy? So the team that came together about 3 years ago from Sixth Sense and MVI, which was a joint venture between the two companies, started, led by John Lockhart, who's the lead of the entire Real team, started by doing the research, right, and going in the research. So if you basically just go to pubmed.gov and do a search for, fairly narrow terms of virtual reality and stroke rehabilitation, there's a lot of articles there. There's a lot of research there that's been done over the last decade, even before Oculus and Vive showed up, right, in the earlier sort of prototype headsets. People were experimenting with VR and doing studies and research. So there is a lot of research out there. So the team just buckled down and started reading and doing the research and trying to filter through what was important, which studies would give us data and information to help build the product. And so there were a few learnings that came out of all of that research that we did. And so for the first thing that we found, which let us know there was a there, is that virtual reality is effective as an adjunct to conventional therapy for stroke rehabilitation, right? So that's played out across many of these studies and articles and random controlled trials, right? So it's a lot of different levels of research has been done, and so obviously some of the studies and some of the research is more meaningful than others. Another key learning that we were able to pull out of all of these studies is that customized systems are much more effective than off-the-shelf devices that you can kind of, try to adapt to your needs and to your design. But instead, if you actually just go to the very ground level and start at what are the needs of the system, what are the needs of the patients, what are the needs of the therapists, and then you can craft this system customized for that need. And so that's exactly what we've done with the Real system, is it is a highly customized solution, as you will see. Another key learning that we pulled out of all of these studies is that 3D fully immersive content helps to rewire the brain faster and more effectively than 2D sort of flat screen applications that you're doing on maybe a monitor or a TV screen. So many of you may have heard and seen some of the institutions and some of the research done with Nintendo Wii, because that had motion control, and so that actually gave the pathway to show how you could use interactive applications, maybe gamified applications, to go after stroke rehabilitation and therapy. And so those do show some benefit for sure, and so that shows that this is a good path to go down. But those that figured out and did studies around 3D fully immersive environments where they put the user right inside of the content showed more effective results. And if you think about that, when I talk about virtual reality content, we're essentially tricking the brain into thinking that it is somewhere that it is not, right? So if we're taking you to Mount Everest, you're actually in a room or you're in a chair, but your brain thinks you're in Mount Everest, right? So if you think about that power that we have with VR to trick the brain, that's what we're trying to do with stroke rehabilitation. We're trying to trick the brain into regrowing these connections that have been lost and repairing those that have been broken and damaged. So VR turns out to be a perfect fit for that particular reason. The final thing is that virtual reality can be fun and engaging, as we know, especially if you gamify it, as I know very well. And so that leads to better adherence by the patients. What we want and what we wanted when we start building this system is we wanted patients to come into their therapist's office and demand to be put back in the virtual reality experience, the therapy that this system will offer. And that's what we're already seeing. And it's super, super exciting for all of us to have people come in and instead of saying, oh, I don't want to put that VR headset thingy on, that was like hot and sweaty. No, instead they're demanding to be put back in it because that was more fun, it's more engaging, it's more interesting for them to actually just get lost in their recovery. So those are the 4 key learnings that we've pulled out of there, and that helped to guide sort of the pillars of the design process for the real system. So how many of you know of the Cochrane review? Anybody here heard of this? Yes, so they're very much about evidence-based decision-making in the healthcare market and likely the leader in the US market for evidence-based decision-making. And so then in 2017, they did a massive study here with 72 trials, looked at 72 trials with over, very close to 2,500 participants. And they came up with several key findings as well, which, this is one of the most important pieces if you want to read up on stroke rehabilitation in VR. This is definitely a good one to go look at. But essentially, the primary outcome was that when virtual reality is used, in addition to usual care, there's a statistically significant difference between the groups, right? And that's obviously what you're looking for. That's what you're trying to drive when you're building an innovative program like this. And so if you're interested, this is certainly a fantastic study. I'm not going to talk too much about it in the interest of time today. But another one of the very, very important findings out of all of those studies was this one, that tailor-made VR systems, custom-made VR systems are effective and valid tools to deliver motor rehabilitation post-stroke. So those are 2 of the very important pieces that we put into our thinking behind the system. And now I'll show you a video that is going out to the therapists that are using the system right now.
Is designed to be easy to set up and use. There are 3 system components besides the charging case. There is also a set of sensor bands. Each patient will get their own to use for the duration of their rehabilitation. Sensor bands come in a separate box. The headset, sensors, and tablet come plugged into the case. Sensor bands are kind of like toothbrushes. Each patient gets their own, so be sure to write the patient's name on their bands box. The headset is comfortably on the patient, and the sensor bands are positioned properly. The patient should be seated with hands on thighs, facing forward. Your login instructions were emailed to you. If you don't find them, contact customer success and they will help you out. Everything you need is all right here. You can see all your patients, add new ones, and enter case notes. Now, let's have a quick run-through of the therapy session. The settings give you control over the session and the activities your patient plays. The length and difficulty of activities are easy to adjust. It's all simple and intuitive. Make sure the device is interpreting their movement correctly via the avatar in the game. One of the great things about VR is that patients see the avatar as their own body. So let the activities begin. Hide and seek has different levels of difficulty to suit your patient's needs. Notice how you share the patient's view from your tablet. Pretty cool. Sunrise is a friendly visual dialogue between the patient and a very expressive sun. This activity encourages postural alignment and symmetrical seated shoulder flexion. The sun reacts to the patient's posture and symmetry with a range of expressions and positions. Smiles mean approval. A quizzical look lets the patient know they need to adjust their posture or body symmetry. Harvest is an objective version of the sunrise activity. Now, Patients will have to raise their arms several times to accomplish a goal, growing beautiful, blue ribbon vegetables for the village penguins to enjoy. With Freebirds, the patient uses functional movements to pick up a bird and place it into a nest. Filling all the nests will reset the activity. You can adjust difficulty settings that require supination and pronation to pick up and drop off the birds, or undertake more challenging positions and movements. In Nest Hop, the patient places birds into a series of nests under a time limit. You can choose a random or defined pattern to the left or right side. This activity is designed to mimic functional, everyday exercises, like putting groceries away, washing dishes, and essential day-to-day activities. In Bird Match, the patient picks up a bird and drops it off in a nest with its matching colored ribbon. We are building upon the movements mentioned in previous bird activities. Once clean, you can now put the tablet and headset back in the case to charge. Plug in the tablet and headset to their respective power cords. The Real system was designed for convenience. All the equipment charges while inside the case. Built into the Real system is comprehensive progress reporting. With individualized data for each patient's progress, both you and your patient can know how things are going. You can isolate parts of the body to see specific data about patient motion. You can even see progress over time. And there's a summary page for an overview. At the end of the session, all data is securely transmitted and saved on the cloud. Rest assured that your tablet will be refreshed at the start of another session. Thanks! Have fun doing rehab with the Real system.
Yeah, so I love that video because it just goes through all of the system very well. But let me just call out the three components of the system here, right? So you've got the patient headset, which is a beautiful HTC Vive Focus, and that's, again, how I got involved with this project. I was at Vive when Amir came through and told us about this product for the first time. And so, very proud to see that is really nice 6 degree of freedom premium headset is key. We think that we believe very firmly that 6 degrees of freedom for the user is very, very important for VR. 3 degree of freedom is no good. That's going to make a lot of people ill because if you're using 3DOF, as you know, if you move your head, the world moves with you, and that's not a natural feeling. So a lot of people are going to feel uncomfortable with that. Whereas if you have a 6 degree of freedom headset, you can actually have the world stand still as you move your head around it, and that makes for a much more comfortable experience. So that's key to have in the system. Then we have the patient sensors, which is the electromagnetic sensors, which offer full tracking for each joint in the upper body, as you can see. So for the wrists and the shoulders and the elbows, all of those are tracked to the millimeter accuracy and without occlusion. So that is actually the really, really magic component of this system, because for the first time, patients and therapists are now going to be able to have millimeter accuracy tracking for all joints during the whole session. And then that can be graphed over time, as you saw in the dashboard. So that's going to allow both the patients to understand how they're progressing and to keep motivated, because they're actually seeing that they're actually moving 10% higher than they were last session, or 20% higher than they were last month. And it's also going to help the therapist, instead of sort of estimating what degree their arm was in that last session, they're going to know to the millimeter, right? So that's going to offer huge, huge benefits to both the patient and to the therapist. And then finally, the therapist tablet is very key as well, so that the patient doesn't really have to select anything. The therapist is teeing up the exercises that are matched to the therapy protocols that they already know and understand. And they'll tee it up and then watch the patient through the streaming of the experience. As you can see, they can see exactly what the patient is seeing. So if they're lost or not looking in the right direction or not following the activity, the therapist can easily help guide them back to what they're supposed to do. And so these three pieces are what make the system unique and make it where it's going to be a very, very impactful product as it goes to market here this year. And then the patient sensor bands are the final piece, and again, each patient will have their own box of these, and that allows for an easy use of the system overall. And as I mentioned, the data that is being saved is critical to the whole platform, because it allows your whole range of motion to be saved, charted, and graphed, helping everyone. So thank you very much. I just want to end with this video from one of my favorite people that's been part of this whole process, Deb, who has unfortunately suffered a stroke, and she has been part of the team that has helped design this system from the very beginning, because she was able to help us test very, very early versions of it, both the hardware and the software. And so I'd just like to close with this video that shows a little bit of her story.
It was 3 years ago that it happened. I was actually in my sleep. And so I really don't know how many hours had gone by before I woke up and I could not move my arm to get out of the bed. What has happened? What is going on?
It was a day I'll never forget. Took her to the emergency room. They ran all the scans. The doctor looks at both of us and says she had a stroke. And the world froze.
I've been working with Deb for 3 years since her stroke.
The rehabilitation process saved me as a human being. I did do physical therapy without the real system, and it's just like night and day. When you're in the real system, you're just thrust into something so wonderful that I think the mind forgets I had a stroke.
Deb didn't like to exercise, but when she put on the real system, she was a different person. The real system was made to address the specific deficits that patients have. It can be used with neurologic diagnoses, even debility. Anybody who needs to work on those same core activities can benefit from the real system.
One of my favorite activities is the bird exercise. You're having a bird get into your hand, and then you're taking them to the appropriate nest. Just a simple, continual use of your hands, your arms, and shoulders. You're actually transported to another world where anything is possible.
When Deb puts on that headset, she becomes so competitive and wanting to know what it was she did last time and how she can beat her score, her accomplishment, or her points. And having gone through the therapy, there's parts of it that may take 6 months or 9 months before you see progress. This, every time you put on the headset, you see an accomplishment and you're able to look back and review what you've achieved and set the next set of goals.
I'm very excited to use the data that the real system can provide in a therapy clinic. There's no way, even with a trained eye, that I can remember every motion that a person did in a whole treatment session. This information will help my documentation go faster. The faster I document, the more I can be treating patients.
I think that it's going to change the way patients see therapy, because all of a sudden you're doing things you've never done before, and it's so positive to your mind and your soul. When the therapist comes in, you're going to get so motivated, but when they leave, it's going to be like, I want to do more the next time. It has given me a whole new level of courage.
So yeah, Deb's story is just so inspiring, and I can't wait to see how she continues her progress in her therapy and recovery. So that's it. You guys here are very lucky because we've actually brought a real system, and so if you're interested to check it out, you can actually try it for yourself. You can go in and experience what the whole system feels like, and we welcome you to do it. You can just see Danielle and Gia that are out there at the table. But thank you very much for paying attention, and appreciate you coming today.
Thank you, Joe.